Let me ask you something most men think about but rarely say out loud. What actually happens if you ejaculate every single day? Is it harmless? Is it helpful? Could it boost performance or quietly sap your energy over months and years? If you've ever wondered, you're not alone. I hear this question constantly in clinic from men across the age spectrum. It's the kind of topic that lives in whispers, wrapped in myths, and sometimes burdened by guilt. Yet it matters deeply for sexual health, relationships, mood, and self-confidence. Today, we're pulling that conversation into the light. I'm Dr. Ivy. I've spent many years treating men's sexual health and helping people translate medical facts into practical choices. In this video, I'll give you a clear, evidence-minded breakdown. 5 surprising benefits linked to daily ejaculation, 5 real drawbacks to watch for, and a practical framework to decide what's right for your body, goals, and relationships. No shaming, no clickbait, just straightforward guidance so you can make smarter, calmer decisions. Before we dive in, tell me in the comments where you're watching from. Hit like and subscribe if you want more honest men's health conversations each week. All right, let's clear the biggest misconception first. There is no one-size-fits-all answer. Daily ejaculation is neither universally good nor universally bad. Its impact depends on the reasons behind it, the context of your life, and how it affects your physical and mental functioning. Some men thrive with frequent release. They sleep better, feel less stressed, and carry more confidence. Others notice reduced desire, fatigue, or relationship friction. The truth lives in nuance. Your biology, habits, and life stage all shape the outcome. If this topic feels confusing, know that it's not your fault. Most men aren't taught the physiology behind sexual function, so they rely on myths. Think of this as a conversation from a clinician who's also speaking plainly. I want you to understand what's happening in your body so you can make choices that serve your life. Now, let's walk through the 5 surprising benefits often associated with ejaculating every day. Benefit 1, mood regulation through neurochemistry. After orgasm, your brain releases several powerful compounds: endorphins that blunt pain and produce calm, dopamine that rewards and motivates, oxytocin that fosters bonding and trust, and serotonin that steadies mood. This chemical mix can act like a reset button. Biologically, it reduces stress signaling, emotionally, it lowers anxiety and irritability, and practically, it means improved day-to-day resilience. For some men, a regular release provides a small but reliable mood stabilizer that helps them face stress with less reactivity. Benefit 2, improved sleep onset and quality. Sex and orgasm elevate prolactin and interact with other calming hormones, which is why many men report feeling sleepy after sexual activity. Combine that with stress-reducing endorphins and soothing oxytocin, and you get a natural pathway into deeper sleep. For men who struggle with racing thoughts or mild insomnia, this can shorten the time it takes to fall asleep and reduce wakefulness overnight, leading to better recovery and clearer mornings. Benefit 3, transient cardiovascular and circulatory benefits. Sexual arousal and orgasm are physiologically active events. Heart rate rises, blood vessels dilate, and circulation increases. This temporary increase in blood flow is like a brief, low-intensity workout for your vascular system. Over time, regular sexual activity is associated with maintained vascular responsiveness, which supports erectile function and overall circulatory health. Benefit 4, potential prostate health associations. Some long-term observational studies suggest a correlation between higher ejaculation frequency and a lower risk of prostate cancer. The leading hypothesis is that more frequent ejaculation may help clear the prostate of cellular debris or inflammatory substances. While this is not a guaranteed protective strategy, and certainly doesn't replace screening and medical care, it's an intriguing piece of the overall sexual health puzzle. Benefit 5, subtle immune and well-being effects. Sexual activity and orgasm can increase markers like secretory IgA and lower stress hormones, which together may support immune readiness in the short term. Beyond measurable immune markers, the stress relief and social bonding from healthy sexual connection contribute to a stronger sense of well-being.
which itself feeds back into physical resilience. With benefits in mind, we must also be honest about downsides. Daily ejaculation can be helpful for some men and problematic for others. Here are 5 potential drawbacks to watch. Drawback 1. Risk of compulsive patterns. There's a crucial difference between chosen, mindful sexual behavior and compulsive use of sexual release as a primary coping mechanism. If you find yourself compelled to ejaculate despite negative consequences, missing work, avoiding responsibilities, or feeling unable to stop, this is a sign that behavior is moving into compulsive territory. Compulsive patterns change reward wiring, increase shame, and undermine functioning. Drawback 2. Emotional avoidance or dependence. Using ejaculation as the singular outlet for stress, loneliness, or boredom can prevent healthy emotional processing. If release becomes your default strategy to avoid uncomfortable feelings, it can block development of more adaptive tools: exercise, meaningful social connection, therapy, or creative outlets. Drawback 3. Implications for fertility. If you're trying to conceive, frequency matters. Daily ejaculation reduces sperm concentration in any single sample because sperm production and maturation take time. For couples attempting pregnancy, spacing ejaculations to allow sperm counts to replenish, often 48 to 72 hours between ejaculations, is a practical approach to maximize sperm concentration during fertile windows. Drawback 4. Dampened sexual sensitivity or reward adaptation. The brain adapts to repeated stimuli. When orgasm is frequent and predictable, some men report reduced sexual sensitivity or diminished spontaneous desire with a partner. This blunting is a neuroadaptive effect. Dopamine peaks feel smaller over time. Short, strategic breaks or varied stimulation can restore sensitivity and rekindle desire. So, what's the practical bottom line? There is no single rule that fits everyone. Ask yourself the right questions. Why am I ejaculating daily? For stress relief, intimacy, pleasure, habit, or compulsion? What are the consequences? Do I sleep better, feel recharged? Or do I notice fatigue, flatness, or conflict? Are you trying to conceive or prioritizing libido and partner connection? Use those answers to guide frequency. Here are concrete, practical tips to help you find the balance that suits you. Track outcomes. Keep a simple log for a few weeks. Note sleep quality, morning energy, mood, libido, and relationship satisfaction. Look for patterns. Experiment with frequency. Try a short trial of daily release and a short trial of spacing every 2 to 3 days. See which pattern aligns with your goals and well-being. Don't let release be the only coping tool. Build a toolkit that includes exercise, social connection, mindfulness or journaling, and hobbies. If you're trying to conceive, prioritize spacing to optimize sperm concentration and time intercourse to the fertile window. If sensitivity or premature response becomes an issue, practice slower stimulation, breath control, and edging exercises to retrain timing instead of speed. Watch for red flags: compulsive behavior, persistent guilt, relationship strain, pain, or changes in erection quality. Those warrant a conversation with a clinician. Communicate with your partner. Honest dialogue about needs, frequency, and mutual satisfaction protects intimacy and reduces misunderstanding. If this topic has caused shame or confusion, remember, sexual health is human health. Asking these questions is responsible, not shameful. Greater knowledge brings freedom, the ability to make choices that preserve energy, strengthen relationships, and maintain vitality. To close, ejaculating every day can be perfectly healthy for many men, and for others, it can signal a need for recalibration. It's not a moral rule, it's self-awareness. Small, intentional adjustments, taking breaks, slowing down, adding variety, and expanding emotional coping strategies, often produce big improvements in energy, confidence, and connection. Thank you for sharing this time with me. If you found this helpful, like the video, subscribe for more practical men's health content each week, and drop a comment telling me where you're watching from. I read every message. Remember, your body is worth understanding, your health is worth protecting, and your vitality is worth cultivating. Take care of yourself. You deserve it. And finally, to my patrons, thank you so much for your continued support. Your generosity allows me to continue creating content for you. If you'd like to financially support the channel and, as a thank you, get exclusive content that you won't find anywhere else, please consider becoming a patron. If you found this video helpful, please give it a thumbs up and subscribe for more videos like this one every week. And don't forget to check out my website, drivy.com, for information on my coaching program designed for men who demand the best from themselves and their bodies. Thank you again for watching. Be well.